So the next session is Dementia and Neurodegeneration in the Aging Brain. The chairpersons for the session are Dr. Mohammad Shamim Kattadka, Consultant Neurologist, Vintage Hospital, Kasargod, and Dr. Vijay Kumar, Consultant Physician, Wenlock Hospital, Mangalore. Inviting the chairpersons onto the stage. It is my honor to welcome the distinguished speaker for this topic, Dr. James Jose, Professor and former Head of the Department of Neurology, Government Medical College, Kozhikode. Welcome, sir. Over to the chairpersons.
Good afternoon to everybody. I'm glad to introduce Dr. James Jose to this session. He is MD from Government Medical College Kottayam, DM from Government Medical College Trivandrum. Then he was the former professor and HOD of Neurology, Government Medical College Kozhikode. Then he presented 11 publications, international publications, 60 national publications, oration and presentation totally around 400. He is authored the book of Cognitive Neurological Examination, then Spinomotor Localization, Clinico-Physiological Approach, and contributed chapters in Advances in Neurology, International Pocket Book of Neurology, API Textbook of Neurology, IAN Textbook of Neurology, Academical Awards as a Master Teacher Award, 5 National Teaching Program. Over to you, sir.
Thank you, chairpersons, respected chairpersons, distinguished seniors and colleagues. Cognition, first of all, I have to thank the Geriatric Society of India, Kerala chapter, Balakrishnan sir, my own friend Naik, and other organizers for giving me an opportunity to present this topic before you. As you all know, cognition and mobility, these are the two simple requests of old people, and the practice of geriatric neurology, geriatric practice is to keep the mobility and cognition. If you are all okay for this cognition as mobility till your end, then you are a graced person. But as you know that the nature is not so kind of to the geriatricians or geriatric patients, because both these problems with mobility as well as problems with the cognition comes to our life as you become old. And of course you have to remember that we are all worried about the development of dementia. Of course, many patients come to you and tell that I have some deterioration, I have problems with the naming, I have problems with the memory, I cannot remember things, I cannot recall things, and we are all confused whether they are normal or not. Of course, you have to consider that aging brain has got some involutional process which is normal. These are called age-related change in the nervous system. They are neuroanatomical, neurophysiological, and neurochemical. The brain volume loss is there. 5% per decade after 40 years. That is the estimated normal brain volume loss. The maximum blend is on frontal lobe, where it is about 12%, and followed by the temporal lobe, which is about 9%. But remember that parietal lobe as well as occipital lobe will not atrophy with the age. If there is a report that parietal atrophy or occipital atrophy, it is pathological. Why this volume loss happens? There are dendritic changes, that is loss of dendritic spines, decrease in number and length of the dendrites. See, you can see that this is a young person's dendrite which is long with a lot of spikes. This is an aged one. You can compare both these two, up and down. You can see that a lot of dendritic spine and length is lost. Here also, in the second panel also, you can see that the dendrites are becoming shorter. The second change is what is happening in synapse. Loss of synapses. And there is decreased activity without neuronal loss. So the function of dendrites as well as synapses decreases. And age-dependent transcriptomic changes in human brain. Transcriptome means the total number of DNA, RNA formed out of gene is called a transcriptome. The number of transcriptome and the volume of the transcriptome decreases as you become older, producing the normal aging process of the brain. And there is what is called immunosenescence and inflammatory aging. That means that as you become older, the immune regulation changes. The ranges in such a way that there is an damage produced by the immune system to our brain. This is what is called inflammaging. The inflammatory process in the brain contributes to the aging process. All this results in loss of certain functions. The main functions which is lost is what we call fluid cognition. There comes as working memory. Working memory means that you cannot hold something for a short time in the brain. Processing speed. You feel that you cannot dial the mobile phone as speedy as previous. Then executive function. Decision making may be difficult. Parallel processing may be difficult. Multiple tasking may be difficult. And your attentional function may be difficult. So that you may not be able to attend a CME till the end of its period. As well as learning decreases, recall becomes difficult, spatial memory decreases. If you are happen to be in a space which is new to you, you may find it very difficult to reach the conference hall or to the restaurant and all in the old age. These are all normal phenomena. But remember that there are certain functions which are well preserved even if you are old. They are what is called crystallized cognition. Language is one. If there is a deterioration language, it is abnormal. Semantics and knowledge. Semantics are facts and knowledge you know. Both are solid functions which should be preserved in the old age. Similarly, visual perception, perceptive function, visually guided, all perceptive functions should be preserved. If any of these are abnormal, remember that it is an abnormal brain. Now, certain functions are there which are improved with the aging. They are problem solving, reasoning, expertise and wisdom. So these functions increase. That's why you know that politicians and many leaders, in morning talk there was a CEO at 72 years of. This is because these functions are increased during the age. So for a politicians, the problem solving, reasoning, expertise and wisdom is the one which is required, not the recall, education or anything like that. That's why the youngest politician will be something around 65 or so. Now, then comes the issue of neurodegeneration. These are all normal phenomena. The issue of neurodegeneration means dysfunction and loss of neurons in the brain and central nervous system, leading to symptoms that affect cognition and movement. I told you that cognition and movement are the two important functions which all people should have, but these two functions are affected by the neurodegeneration. Neurodegeneration is a chronic and progressive in nature, increase in prevalence with the age, destruction of neurons in specific areas, damage to synaptic connections and selective brain mass loss are the feature. The basic problem for a neurodegeneration is what is called protein misfolding. There are so many proteins in the brain, some of them may go misfolding. These are monomers of the misfolded protein. These protein, they become oligomers. Then they become what is called protofibrils. and finally they become mature fibrils. Most of the neurodegenerations are related to this protein misfolding and formation of mature fibrils. If you take these diseases like Parkinson's disease, dementia with Lewy body, multiple system atrophy, they are all neurodegeneration where the misfolded protein is what is called synuclein. And these are, we group them together as what is called synucleopathies. And on the other hand, there are other protein which is getting misfolded, is what is called tau proteins. And we call them as tauopathies, where comes Alzheimer's disease, frontotemporal dementia, corticobasal degeneration, progressive supranuclear palsy, agrophilic brain disease, and chronic traumatic encephalopathy. These are all tauopathies. I know that many of the people here are youngsters. If you search your old people in and around, you will find that many of your neighbors, parents or grandparents were immobile and cognitive dysfunction because of some of these diseases. That is the prevalence of these diseases. In and around you will see them if you critically examine them. And of course you will see that disease like motor neuron disease. There are also misfolded proteins like TAR, DNA binding protein, and certain prion disease like Creutzfeldt-Jakob disease, chronic disease. They are prion proteins which are misfolded. So it is the misfolded protein which causes neurodegeneration. And you should remember that the frightening fracture it's a contagious phenomenon. The protein misfolding is a contagious phenomenon. You see that from this fragmented one, seedlings are coming again, and this is getting propagated. Molecule to molecule spread, then cells to cell spread. You can see that from one part of the cell, the misfolded one migrate to other part to produce further degeneration, and from brain region to brain region spreading, from one part of the brain to spread to the other part of the brain, resulting in total dysfunction of the brain which starts from some particular area. And this misfolded protein seeds in biological field like CSF, saliva, blood, urine and feces, and this is a chance for us to high sensitivity detection of them, this biological secretion, and predict what is happening in the CNS. Now you come to the dementia of the neurodegeneration. I will see that we are all afraid of dementia, the cognitive problem. The dementia is now redefined as a major cognitive disorder, neurocognitive disorder rather than dementia. And it is defined as a significant decline in one or more cognitive domains, So many definitions were going on for dementias. Dementia is initially described as a global cerebral dysfunction with preserved consciousness. Then again it was diagnosed as a cognitive dysfunction where two or more cognitive domains are affected, where it interferes with the patient's daily activity, like that. Finally, now it is considered that to say a patient is having dementia, any of these cognitive domain affected in a significant way that it is interfering with the daily activity, then you can call it as a dementia. These domains are learning and memory, executive function, language, complex attention, perceptual motor. Perceptual motor means that the ability to do something, some skills, and social cognition. Social cognition, the ability to understand others, the keeping the social decorums, the eating ethic, everything comes under social cognition. When any of these domain is affected, it is a dementia. Now remember that dementia is a primary dementia. The commonest cause of dementia is primary dementia. It is commonest one. The sad thing is it is not treatable. Then there is secondary dementias where there is a cause and most of them are treatable. And finally there is what is called a vascular dementia, which I consider as a separate entity because it is preventable. So when you think of a dementia, what you have to remember is whether it is a primary dementia, whether it's a secondary dementia, where there is a treatment, and whether it's a vascular dementia, a chance of a vascular dementia which is mainly treatable, preventable. Now the primary dementia, 3 types are there. One is what is called Alzheimer, which affects the medial temporal lobe initially. Then comes the frontotemporal dementia, which affects the frontal lobe. And there comes the Lewy body dementia, which affects the occipital lobe. Depending on that, the Alzheimer's patient will have a predominant memory. The frontotemporal dementia will have a dysexecutive function and behavioral problem, and Lewy body dementia will have visually related problem. That is the 3 primary dementias. Of course, I want to tell a few words about the Alzheimer's dementia because that is the commonest and the most dreaded dementia which we deal. See, the Alzheimer's dementia is caused by again protein misfolding. 2 proteins are, one is A-beta amyloid protein, second is what is called tau protein. They are hyperphosphorylated tau protein, and amyloid protein will form a amyloid plaque. These are the 2 histopathology. And the pathogenesis is that this amyloid precursor protein, which is present normally in our brain, is a normal component of our brain. It is cleaved through a innocent pathway when there is no problem. This is what is called the alpha pathway. When it is cleaved by a beta pathway, the amyloid precursor protein forms what is called the A-beta 42 and B-beta 40 proteins, which are the culprit which forms amyloid in the brain, monomers, oligomers, protofibrils, mature fibrils, and finally neurotic plaque. This is the result. And remember that these 2 monomers, they forms neurotic plaque and they are secreted in CSF and blood. As the amyloid start getting deposited in brain, its secretion in the blood and CSF decreases. Now, in a big way, detection of Alzheimer's, this is in an early stage is coming because CSF and blood estimation is coming and you can see whether it is present or not in the blood. Like that, the phosphorylated tau, they are again secreted in CSF and blood, and increased level of p-tau in CSF and blood is seen in the preclinical stage of the Alzheimer's. Remember that the classical Alzheimer's, this is present with episodic memory impairment. Then the frontal lobe is affected, dysexecutive function, disinhibition, apathy. Then comes the anomia, language, agnosia when the parietal is affected, and topographic disorientation when the parietal is affected, and the occipital function will be preserved till the late stage. Variant Alzheimer's, this is developed in young age, characterized by visual variant where the visual functions are lost, unlike the classical one. Then comes the praxis variant where the patient is not able to do anything. Then comes the language variant where the language function is lost, and the frontal variant where the behavioral variant where the executive functions and behavior become abnormal. And you should all remember what is called the concept of Alzheimer's continuum. Because for any Alzheimer's patient, there is a 20-year biological history. Of this, 10-year is preclinical, which is amyloid accumulation happens, normal cognitive function. Then there comes the prodromal stage of 4 years where mild cognitive impairment. Finally, the dementia stage, which may be mild, moderate, or severe. And in the corresponding amyloid PET, you can see that in the final stage only the Alzheimer's disease developed. There is another scan which is called tau PET, where also there is a normal stage when tau is positive, but patient is clinically normal. Like that, you should remember that many of us maybe, it's about a history of 20 years means that many of us are in the preclinical stage of Alzheimer's disease. And now the methods are coming to pick up early in the course and treat them as early as possible. So the burden is so much, about 15 million in preclinical stage, 69 million in prodromal stage, and 32 million in dementia. That is the word burden. About the age of 50, this is the burden of the Alzheimer's. And there are some hopes and concern. Lecanemab is coming, a humanized monoclonal antibody that binds with high affinity soluble A-beta microproteinum, which have been shown to be more toxic to neuron than monomers or insoluble fibers. This is now marketed, and there is trials which is showing effect. Then comes donanemab, which is also going to be marketed. We don't know the effect, but good early reports are there. But of course, there is a caution, that is, whenever you administer this one, problems are there. these are called amyloid-related imaging abnormality. They may develop white matter hyperintensity, which may sometimes be more worse than what is the disease itself, or it may be area H, where they can develop hemorrhages. You can see that there are sulcal hemorrhages. And of course, when you remember primary dementias, don't take granted that all dementias are Alzheimer's or degenerative disease. All diseases are, you have an eye on treatable dementias. I have enumerated subdural hematoma, NBH, infections, space open lesion, endocrine abnormalities, nutritional, drug and toxin. This is what you have to remember. In a geriatric practice, there will be, as the previous speaker was saying, 20 drugs, 30 drugs will be there. You may not be knowing that the drugs which are prescribed innocently may be a reason for the cognitive impairment. And of course, depression, which is very common in geriatric practice, may exactly mimic that of a treatable demanding illness. And finally, remember that vascular dementia, you should remember that lot of modifiable factors are there which should be done at this stage, not after developing the stage. We are not convinced of the importance of this one. So you know that with the time passes, the commonest dementia, Alzheimer, followed by vascular dementia. And you should remember that the Alzheimer's spectrum aggravates with the development of vascular dementia. So combined dementia is the commonest one. So modify all these factors: hypertension, diabetes, high cholesterol, smoking, obesity, physical activity, homocystinemia, ultra-processed food, avoid all these things and modify that. Then you go for the lifestyle practice, nutrition, Mediterranean diet, tea and coffee, dietary modifications, pro-longevity molecules like metformin, red wine, rapamycin and all. So aging is associated with the involutional process of the nervous system, on which many age-related diseases are added. Protein misfolding is the pathophysiological basis of most of the neurodegeneration. Dementia, the most common neurodegeneration, is to a certain extent treatable and preventable. Thank you.
Thank you, sir. Thank you for this wonderful session. And dementia being one of the most important disease among the 50, 60 plus. So I would like to add a point that the caregiver burden is another important factor among the dementia patients. Also, like who is taking care of the dementia patients, which we all see on a daily practice basis. Thank you, sir.
Sir, my question is there any role of yoga and music therapy in postponing the dementia or preventing dementia?
Pardon, sir?
Is there any role of yoga or music therapy in preventing or postponing the dementia?
Definitely. You see, I used to say that, and I told you that once dementia is developed or developing, you cannot prevent that. But there are so many means to delay its development. When you see a patient with dementia, my target is not to see what is lost. My aim is to see what is preserved. Keep the brain active. The fortunate thing about most of the dementias, except a few, is that their occipital lobe and the auditory cortex is relatively spared. So the visual clues and music and other things will stimulate the brain and keep the circuit active. The more the circuits are being active, seeing the music, hearing the music, seeing the dances, seeing the things, they all keep the circuits active so that the brain will always be active. It will definitely delay the development of dementia. Even for a patient who has dementia, the deterioration will much lesser If you are engaged in activities like that, I don't know whether you can call it as musical therapy or not.
Any question from the floor?
Thank you, sir, for that wonderful talk.